A very warm welcome to you all, selected ladies and gentlemen, to the World's Human Sciences and Management Conference 2021, organized by Center for Adivasi Research and Development, Odisha, in association with Indian Institute of Management, Sambalpur, and Central University of Odisha, Koraput. The broader theme of this conference is agnotological context, disciplinary practices of social sciences, and policy frames. On behalf of CARD, uh, my heartfelt thanks to our coordinating institutions I am Sambalpur and the director of I am Sambalpur, Professor Jaiswal, and Professor I. Ramabrahma, the Honorable Vice Chancellor of Central University of Odisha, and Professor S.K. Palita, Dean Biodiversity, Central University of Odisha. And I would like to thanks and congratulate the convener of this August conference, eminent historian, Professor Chandi Prasad Nanda, and eminent policy activist and logician, Mr. Charudatta Panigrahi. Friends, this evening is going to be very special for us because we have Professor Steve Dick from Southern Illinois University, United States. Professor Steve is going to speak on COVID-19, lockdowns, and the differential effects of the working poor in United States. Before we start the meeting, let us hear a few lines about Professor Stephen J. Dick. Professor Dick is an assistant professor at Southern Illinois University at Carbondale. After working several years in public broadcasting and earning a PhD from Michigan State University, he began his academic career at Mackenzie State University, Louisiana, in 1997. He joined the faculty of Southern Illinois University at Carbondale, where he currently teaches and conduct research and the School of Mass Communication and Media Arts. Professor Dick specializes in new technologies and media management. Professor Dick, we heartily welcome you. And now, without wasting much time, I would like to invite Dr. Samuel Lima to going for the introductory remark and invite Professor Dick for his talk. Over to you, Dr. Lima.
Thank you, Rudra, for inviting me. And also, Rudra already has told about the Professor Steve Dick's background. He is the assistant professor at the Southern Illinois University. So I don't want to waste my valuable time. So without any wasting time, it's my pride and honor on behalf of all the participants, those who have joined in this program in the Zoom meeting, and also those who have already connected in the YouTube, Twitter, and Facebook, and also on behalf of all the people and all the participants, and also on behalf of the Indian people, it is my great honor to welcome Dr. Steve Dick to this World Human Sciences and Management Conference. Over to Dr. Steve Dick.
Well, thank you all for inviting me here to talk about my most recent research. This came up mainly as a charitable service to a number of groups called United Way in the United States. United Way used to be the kind of thing that would go to a business and collect money from the business and redistribute that money to a number of charitable organizations. They've transitioned over the past years to collect money inside a business, but then direct it towards their own social efforts. Am I being heard? Oh, okay. Are you having a problem hearing me? Okay.
No, it's okay.
Okay. Anyway, once the COVID lockdowns went in place last year at around May and June, I reached out to the United Way of Louisiana, a group here close to my home, and said that I would do a survey. They agreed to do a survey, and what they were trying to do is they were trying to determine how to direct their charitable efforts and how to direct their policy. This survey was noticed and it was picked up by several other states. And as a part of this, I started working with charitable organizations. I started working with United Ways from different organizations. Let me see. I want to share my screen. Let's see. Having problems. I checked this out before and I forgot how to do it. Anyway, I'm sorry, I'm having trouble sharing my screen. I apparently don't know what I'm doing anymore. Anyway, okay. The survey was sent out initially in Louisiana, Texas, then Texas followed in North Carolina, and I worked with all three states. And I sorry, I wanted to show you the PowerPoint, but I can't seem to do that. Oh, there it is. I'm sorry. I'm sorry for the delay. I just don't spend enough time on this. You should be seeing the PowerPoint now. We collected 2,000 surveys in Louisiana, another 3,000 in Texas, which is the most populous state. North Carolina worked hardest and collected a total of 8,500 surveys. In all, we looked at 14,000 people across the three states. This means that while we had a volunteer sample, we had a fairly good representation of most areas in the United States, of these three areas in the United States. For those of you that are not familiar with the United States, I'm going to show you a map of the United States here. And it shows you that we have Texas, Louisiana, North Carolina, East Coast. It did not get into some of the larger areas on the East Coast, such as the New York City, Boston areas, or the West Coast. I understand California did a similar survey, but I didn't work with them. And this just shows you the number of responses that we got back, depending on the location. Now, the goal of this particular study was to think about the main concerns of the people who were being affected by COVID and the related lockdowns. The economic effects associated with COVID, how families were affected, and how COVID affected people in poverty. There were special questions that were put in by individual states, and some states changed the questions a little bit to suit their needs. What I have here is not all of the data, but I have a representation of some of the best information that we could do, and an idea of the kind of study that we were able to put together. I'll be going to publication with these data very soon. Income level was particularly concerning because what we had was that we have a federal poverty level that was established in 1963. The United States definition of how you define federal poverty level came in 1963. It's defined annually by the U.S. Department of Health, and it defines the type of people who receive state and federal benefits of one kind or another. The problem with the federal poverty level is that it's defined nationally, and it does not take into account that in some places housing is more expensive, in some cases transportation is more expensive, and not to mention the fact that in 1963, the type of things that people were buying were very different than they are today. And so United Ways have been working with an organization that puts together what we call the ALICE Index. ALICE is Asset Limited, Income Constrained, Employed. These people are the working poor. Now, Louisiana and Texas participate in the ALICE Index. Louisiana and Texas participate in the ALICE Index. North Carolina does something very similar, defines it in a very similar way, and they call this the self-sufficiency standard. The self-sufficiency standard becomes a little, it's basically defined the same way. The thing is that these two indexes is that they start to define real things that the working poor actually need. They need to find a home that's large enough for them. They need to find transportation to work. They need to find daycare if they have children in their household. They need to find even cellular communication so that they can get phone calls from work and everything like that. It redefines what is a person in poverty is required to have. And so what I had here was I had three levels. I had those that were clearly in poverty, those that were what I called endangered, because it was these are the people who are under the ALICE threshold and under the self-sufficiency standard threshold together. And then secure. I would expect, I know that in Louisiana, the combination of endangered and in poverty is about 50% of the Louisiana population. I would expect that what we've done is because we have an oversample, because we have a volunteer sample, we probably oversampled the secure population. They were the ones that had the time to take the survey. With that in mind, we're not really saying how many people are in these groups, but what we're saying is that we're comparing the differences between these groups. If you have an interest in these, just saying United Way ALICE Index would get you to the resources of some excellent researchers. I sit on a research advisory board for the ALICE project. In North Carolina, North Carolina Self-Sufficiency Index, that will get you to those people. And they just have a slightly different way of defining these terms. And so defining income by these three groups, I'm able to look at what is the poverty level, what is happening at different levels of poverty. Now I'll finally get to the next slide. The next variable that was key to us was the impact of COVID. What happened with the survey is that they ask a series of questions. Are you afraid of this? Are you concerned about this issue, this issue, this issue, this issue? And the second thing is, do you particularly need these particular items? And from that, I created a COVID impact measure. Now, these groups were slightly different by the states because they like to define them a little bit differently, but generally there was medical needs, the fear of catching COVID, a fear of self or a loved one catching COVID, servicing other medical needs, mental health needs, medicines, things like that, all fell within the medical needs category. Second was financial needs. With the lockdowns, a lot of people lost their jobs. And so rent and mortgage issues became an issue. Paying other net standard bills became an issue, and getting the supplies they needed. Just being able to go to the grocery store and figuring out how they get something home from the grocery store safely became a pretty big issue. Finally, because the schools were also locked down, and it looked like they were going to be locked down in the fall of the year, children's needs, such as how to take care of the children, how to take care of the children's education, the child care expenses. A lot of child care centers were shut down because they were afraid of sharing COVID across the children, and simply entertaining the child. In Texas, they were quite concerned about summer camp for the children. And so what I did was that if the respondents answered one of these fears or one of these needs, then they got 1 point. There was a question that says, do you have no needs? I don't need anything. If that was the case, then I thought about this. This was kind of a research decision on my part, was that I decided that if they claim to have no needs, then I divided their entire score by half. So it was simply counting up the number of needs and the number of fears that they had, concerns that they had, and creating a number of points. But if they had no particular needs, if they said, I just don't need anything, I'm fine, I divided that by half. And I took that primarily off of my own family. My wife and I were here at home. We were in a comfortable home. We were blessed to be with a comfortable home. We were scared of COVID. We were worried about our community and everything like that. But we had no particular needs because our income was continuing and we could do our work from our home. And so I had some impact of COVID, but I didn't have as strong of an impact as some people did. So what I did was that I created simply a measure. It usually ran from about 1 to 20 points as far as needs and concerns about COVID. And then I ranked those people and I put them in quartiles. And that made some of the things that we were looking at, going to look at much easier to deal with. Fear of catching COVID was the primary concern among everybody. And of course, with the survey, it's going to point people out that there's a problem with catching COVID. So this is going to be top of mind. I left that out. Fear of themselves or a loved one catching COVID was considered to be an important item. But the thing is that among the secure population, people with a secure income, 78% were looking at that, where among the people in poverty, in the most extreme poverty, we're looking at 66%. Now we're looking at a dramatic, and I haven't done the test, but I think eyeballing the data and everything like that would say that there is a significant decrease based on income level as far as the fear of catching COVID. Other medical issues, such as being able to go to the doctor for other things, being able to get your prescriptions, mental health services and things like that. This is where we saw a difference. The people in poverty were a little bit lower than the people who were in the endangered category, the working poor. Endangered category were the highest associated with the concerns by income level. Paying bills, naturally you can understand that the greater poverty risk that you have, the greater concerns that you have in paying bills. 81% to 33%, depending on your income classification. Children's issues and everything like that, a much greater percentage of people at the endangered or poverty level were concerned about being able to take care of their children. And then there's going to be some more information on that particular issue. 51% of those people who were in secure category were fear of taking care of their children. Now, part of this difference may be because one of the things I found is that senior citizen households, people who were in retirement or on some kind of long-term plan where they didn't really have to work, these people were surprisingly less impacted by COVID because all they had to do was stay at home. All they had to do was continue the behavior that they had done, that they had pretty much done before. And of course, they were less likely to have children, so they're going to have less issues. The highest impact of COVID, remember, because we did quartiles, the average should be at around 25 to 27%. I had to break it based on the number. So what we have is that we have people with a secure income having a much lower impact. The percentage of people at high impact of COVID. Oops, we go back. Only 19% of them, and this is far lower than normal, where the people who are endangered in poverty are having a much higher impact of COVID overall. So, other variables that were considered, and this is a fairly rich data set. We've got a number of problems that we were looking at, particularly across different states. The effect of the working poor status, low financial reserves. One of the questions we ask is, okay, before the lockdowns came, how much savings did you have? How long would your savings allow you to last without a job? And one of the things I'm going to look at here in a minute is people who had 2 weeks or less of savings. They could last 2 weeks or less with the savings that they had without income coming in. The other thing is job loss. Very frequently, particularly those of the working poor and those in poverty, have multiple jobs. And so one of the things I looked at was the percentages of job lost by family, by the household. Household status, we looked at single parents. We looked at the need to buy technology to endure the lockdowns, childcare affected, and facing eviction. Something I'm going to show you in a little bit. A number of the households were facing eviction or foreclosure, so they'd be thrown out of their household. Now, the United States instituted a policy that eviction and foreclosure could not happen during the height of the COVID lockdown, and this caused a problem for landlords. But that is still to be worked out. And it didn't impose restrictions on all landlords. Some landlords were still able to evict people, and sometimes people would be evicted not for non-payment, but they'd be evicted for other reasons. The landlords would come up with a maximum number of people in a household, and they would evict households that had too many people because of COVID restrictions. They would reduce services to the building, and they would declare the building unlivable because they wouldn't have water in the building or something like that, and they would evict people based on these issues. Ethnicity became a prime consideration because a number of the United Ways are servicing minority groups. Geographic distribution. Senior households, I've already talked about, is that the senior households were not nearly as impacted as other households. And then married families. And I should say with married families, one of the things that we were looking at is that we were looking at families that had a couple managing the household and families that were run by a single head of household, particularly a single female head of household. This became an issue over the year. Income level and financial reserves. Light green is the low income reserves. That means they had 2 weeks or less of savings to stand. And of course, 2 weeks is not very long, since many of these people get paid on a weekly or even a monthly level. And then some reserves are any level above 2 weeks at a time. And so percentage of high impact of COVID, secure people who had low reserves were just about average, where secure people with higher level of reserves were far below what we would expect in the quartile. Then we go to endangered. We're seeing a much higher impact on the working poor who have low level of reserves. And then people in poverty who have low levels of reserves. Very frequently, a lot of the people who United Way is trying to help are these two groups, the endangered and in the poverty group. And so they wanted to see how the fact that they didn't have money put aside for a lockdown that could last months on end would affect what they could do. And a lot of these people were very worried. One of the side questions was that we started looking at how did you cover? Some people took out loans, some people borrowed from family, some people put it on credit cards of one kind or another. A lot of people turned to food banks. There was a big rush on food banks during the COVID lockdowns and everything like that. It became a big problem. Economic effect on the family, what I'm looking at here is in this particular graph, I'm looking at percentage of job loss, family household job loss based on income levels. And here what we're looking at is that those who are in poverty lost 64% of the household jobs on average. People who were in the working poor lost 51% of jobs on average, where those that were in a secure category, 27% of them lost jobs. Now, job loss was defined by whether hours were reduced, the job was lost completely, the job was interrupted for a period of time, whether the person had to leave one job and go find another, if job did not continue at the same level over the COVID lockdowns, then it was defined as job loss. At the same time, childcare was impacted much more heavily in households in poverty and in endangered households than it was in regular households. Now we're looking at 50% at least of the households losing childcare services, which means that if I couldn't work from home, or if I couldn't just stay home, then I actually had to find some other way of handling my children being at home, because I no longer had a daycare that I could send them to. I no longer had somebody that would babysit the children. And this meant that in many cases, the families lost jobs because they couldn't leave their children at home by themselves. Some families would work together to try to babysit. Some people had to shift their employment times so that they could hold on to their jobs and still be able to babysit their children. There were a number of different choices that families had to make, and they had to make them fast because of the child care centers closing down. Technology changes. One of the things that I found that was most interesting is that the people who are in greater poverty had to buy more technology to endure the lockdowns than other people. That people who, and this is actually also true by the people with the lowest financial reserves, buying some technology at all, anything from a computer to a computer desk, was much higher in households in poverty and in households that were endangered. One thing that was more is that this continued, and this was exacerbated by households that had to buy a major device, a computer, a tablet, or a cell phone in order to endure the lockdowns and allow their children to allow work to continue, or their children to have distance learning. And so you had 28% of the households that were endangered and 32% of the households in poverty that ended up having to buy a device, an expensive device. These things could run hundreds to thousands of dollars to get these things in the house. In a few cases, school systems donated computers to households, but the problem is that the low-end computers that could be given to a household in need also ran dry during the COVID lockdowns. They couldn't buy enough of those computers, so the kids could work at home. Internet was added in more households that were endangered and in poverty. You can see this. My daughter worked on a project here in my hometown of Lafayette, Louisiana, where they put up Wi-Fi hotspots in the high poverty section in order to provide internet access to some of the children that are in greatest poverty. Now, there were limits to the tech to it, so that the kids couldn't spend all day on Facebook or something like that, but that they could work with their school systems and continue their education. In North Carolina, they asked a couple of questions. One is, one of the key questions was, do you have home internet? And I looked at two questions. One is, did you have home internet before? And did you add home internet? If they didn't add and they didn't have internet access at the house, then I said, okay, there's no home internet. They can't do distance learning. They can't do remote work. And of course, the ones in poverty, 18% of the households in poverty have no home internet even after the start of the lockdowns. They just don't have any place they can go. And of course, libraries and government buildings and other places like that, where one would normally go in order to access internet capability when you don't have it at home, were also closed down. So this began to point out the problems that a lot of people had with being able to continue their distance learning in one way or another. Now, I started putting in some geographic effects. This is the state of Louisiana. The size of the household is the percentage of the people in that particular case, in that particular, what we call parish. It's equal to a county or a government subdivision. The size of the household indicates the number of people, the percentage of people in that household, in that area, that are in what's called the ALICE status. I live in this relatively economically well-off category right there in the state. This is a New Orleans area. Extreme cases of COVID. The darkness of the government division indicates the percentage of people who had COVID early in the summer. And then you had the Alice household. So you have places, one of the things we can do with this is that we can look at this particular area right here, just south of New Orleans, where people can, there were a great deal of poverty, and there was a great deal of a great deal of COVID going on at that time. This section up here is a primarily African-American minority area, and you can see that there is some high cases of COVID and some relatively large number of Alice households. This area here is also African-American in the north, the northeast section of the state of Louisiana. Oh, I'm pointing at the wrong screen. This area over here is some of the northeast section of the screen of the map is high minority population, but it was also very low population. So in the early summer, when the survey was done, there wasn't a great deal of COVID in that particular area. We saw most of the COVID. This is where I made a mistake before, down here in the New Orleans area. One of the other things that I did, and this is from North Carolina, is that I brought in data from other sources. And this was the social determinants of health. And what I'm looking at here is that I'm looking at a region of North Carolina where we have large pockets of what they call concentrated poverty. These green areas are large pockets of concentrated poverty. You then have their major city in this particular region, Fayetteville, North Carolina, which also has large pockets of concentrated poverty all along the one side of the region. This does is that we also looked at this area. This particular region has generally higher transportation costs, higher health costs, lower than average costs for housing and food. They have a relatively high level. They had a relatively high level of unemployment before COVID, and they had somewhat higher than normal housing burden costs. That meant that 27% of the population, 27% of the population was considered to be spending more than an acceptable amount of their income on the cost of housing. And low access to grocery stores. That meant that some of the people, particularly I would imagine, these people in these high areas of poverty where there's not a great population, were not able to get to a grocery store very easily. And so what we did was that we started to look across, saying, in this particular region of North Carolina, we have extreme poverty in particular areas, and we have particular problems associated with COVID. One of the things that we saw is that the number of households facing eviction and foreclosure in this particular region was double those outside of the region of that region of North Carolina. It was up to about 8%. Okay, and so what could happen is that the charitable organizations in this area could start to worry about the people in poverty in particular and try to address their issues as opposed to some of the other issues associated with COVID. North Carolina, we looked at the open-ended questions. One of the things I did was almost always do I ask, what is it that you would like to do? What is it that you would like to say? Now that you've taken this survey with maybe 40, 50 questions, is there anything else that you'd like to say? And I started categorizing their first response. And you can see up here at the top, employment issues were the highest concern. They would come back and say, I wish I could have a job. I wish I could do something. Children in schools were next. Simply thanking the United Way for their work was another particular issue. It became a political issue in the United States to reopen the economy, and a number of people were expressing either concerns that the economy would be reopened, the businesses would reopen too fast, or that they weren't opening fast enough. And this was closely associated with a number of political comments. The Democrats are doing all of this to us. They're faking it because of that. The Republicans are getting in the way and things like that. And then this goes on down to a number of people here at the bottom, and it was quite touching. A number of people, there's only less than 4% of the people, but they were saying how fortunate I was that I'm able to survive this. I'm able to do it. I've been blessed by God because I've been able to get through all of this. So I see that I've run through my time. So I'm going to try to stop sharing my screen as soon as I can figure out how. And I guess it's time to open up for questions.
Thank you so much, Dr. Dick, for the statement regarding the COVID-19 and lockdown and differential effects on the working poor in the United States. We are really grateful and thankful to you. Just very briefly, I can say a few things that what you have presented in this particular topic, this valuable topic, and is really the need of the hour. And you have mentioned that the survey particularly in the 3 states in the United States, the Louisiana, Texas, North Carolina, and we also raised the question to what are the main concerns and needs in this regard. And also you have mentioned the income levels and the poverty levels, particularly on the federal poverty level. And also you mentioned the medical needs, financial needs, children needs. And also you have also raised some of the very important issues like particularly the economic needs, the income level, working poor status, job, the household status, and the children, how the children are affected by this pandemic, the COVID-19. And also you may have mentioned some of the demographic data. Also you have mentioned some of the income level and financial reserve. And also you have mentioned economic effect on family. Also you have mentioned some of the technology changes by income level. And also you have mentioned that no home internet, the 80% of the poor in the North Carolina. Okay. Thank you so much for being with us, Steve Dick. And right now it is this presentation is open for debate, and some of the questions have already mentioned in the chat box. You can also read out the questions and answer them accordingly. And also I invite some of the participants like Dr. Kama Prasad Mishra and Dr. Vikram Kesarjana, and also some of the those who are interested, they can also ask the question, and also you can also write the question in the chat box, and also you can ask directly to Professor Dick. And it is up to Professor Steve Dick. You can answer the questions which are mentioned in the chat box. Professor Dick.
I see. Okay. Let me see. I'm going to go back up here through the chat box. One of the things about the effects on the pandemic on the urban poor is that one of the things that we're going to have to do is they're going to have to define the areas that we have. We've got zip code level data, which is a fairly concentrated area. But what I need to do is I then need to go and define, and there are databases that are available that I can import and say that this zip code is an urban area, this area is a suburban area, which is that difference between urban and rural, and then there's the rural areas, and I can look at the various effects. I haven't yet done that. I expect that one of the problems that we're going to have is that political effects will come into play because the rural areas are primarily associated with a political party that was denying that COVID was a problem. And so one of the things that we might find is that we might find that rural areas were saying, forget about it, because particularly early in COVID, and the survey was done between May and September of last year, COVID hadn't reached out to the rural areas, and the rural areas are the type of people that would say COVID isn't an issue, it's all a fake and everything like that. So we might have multiple effects going on. Let me see. Trying to get down here to this next one. One of the things that we had to deal with as far as policy changes, and it became important across the board, and it is a part of President Biden's initiative, is that preschool care, care for children who are below the age of going to school, which is 5 years old in the United States, would be supplied. One of the things that we found is that the working poor, particularly the ALICE groups, depend on somebody taking care of their children. And the policy initiatives that are done in Louisiana and is taking hold across the country is that the working poor actually need childcare. And so there's greater funding heading towards the childcare and the childcare centers. Right now, early childcare, such as those for people from 0 to 4 years old, children 0 to 4 years old, a lot of these are run out of people's households. And I used to work with a research center that specialized in these particular centers. I visited a couple of them, and it literally was, in many cases, it was somebody's home that they had converted into several rooms for children. And these people were operating at a very low margin. And when they had to shut down because of COVID, many of them were not able to start up again because they simply didn't have the money to keep their businesses afloat. And so this is going to be one of the things that we're going to see in the very near future, as far as how do we deal with this. There is also going to be the issue of foreclosures that is going to come up just about any time now. I'm working with a housing group here in Louisiana where foreclosure protection is going away. And the foreclosure rate for people in poverty and generally the working poor is going to be extremely high. These people are going to be thrown out of their homes, and very likely this will be difficult to get a new rental property because landlords don't like to rent to people who couldn't pay their rent. And so how do you deal with trying to allow these people to catch up on their old rent, allow them to get back, allow them to stay in their homes and be secure enough that they can go back to work? And there's a lot of people within the state of Louisiana and nationally to try to deal with this particular issue. How do we deal with this thing? And it affects the landlords, because if I'm throwing 40% of my people out of their homes, I've got 40% occupancy rates that I can't fill. Let me see. Typical American household. You know, I looked, because I looked at the households that had 2 weeks or less of reserves. That was really rather artificial. I could have expanded that to at least a month or so of reserves. I don't think there was many real households in the United States that were not affected by the COVID lockdown in some way or another, and could really afford it. The one exception were senior citizens that were on a permanent fixed income, that they had a retirement income that they were living off of either through investments or retirement account, that these people were less affected by COVID. Now, they were more likely to catch it, so they were more in fear of COVID, but that was only one measure. They still at least had a steady income. My wife and I were essentially thrown into distance learning. My wife is a professor at the local university. I'm a full-time researcher, and I work by distance anyway, so we could stay in our home, and we were relatively lucky. We only had to deal with the mechanics of getting supplies and things like that without catching COVID. But we lived in a relatively comfortable home. Like a lot of senior citizens, it was possible to deal with that. But many of the other people in the country just didn't have enough money to withstand the loss of income for months on end. And some people went back to work catching COVID and then had medical bills associated with it. Job losses were a big thing. United States increased unemployment benefits during the time of the major COVID lockdowns and everything like that. They provided a few $1,000s worth of supplementary income to everybody in the country. Almost everybody in the country. Those at the highest level of the incomes didn't get it. And even I got a little bit of money to continue my business while I was when COVID was going on. I have to either pay that, I either have to show that I paid that to business related expenses, or it's a 5-year loan at 1% interest, which is a really pretty good deal. So they did their best, although to tell you the truth, I don't think anybody was ever ready for this. And the last administration spent so long denying that it was a problem. The last presidential administration spent so long denying that it was a problem. It probably exasperated the issue both in the United States as far as number of people who didn't take proper care of themselves and people who were not sympathetic to those that were put out of work because of COVID. Since then, the administration has changed. And of course, the vaccinations have been widely distributed in the United States. So we do not have nearly as much of a problem. We still have large pockets of people who refuse to take the vaccination. My particular geographic area where I live is very supportive of the last administration, and only about 30% of the population has taken even part of the vaccination, which means we're far below the goal. The fact of the matter is, what it seems to be happening is that without a variant that can bypass the current vaccination, people who are vaccinated are relatively healthy at this point. And what they need to do is they need to get back to work, and they need to go back into doing what they have to do. But then we still have large pockets of people who won't vaccinate. And I'm looking at the people who won't vaccinate. The biggest issue with people who won't vaccinate are people of multi-race, and I'm trying to figure out why that is. Asian population was very high at vaccination. Black and white population were about equal at the vaccination hesitancy, and male females were about equal. It's a little confusing to me as to why certain people have decided that they won't do it, and there are multiple reasons. Many of them are either political, or they just don't trust the medical coverage area, medical coverage in the United States. But we're at about 65 to 68% vaccinated in the United States. And so people are starting to reopen. Let me see if there's anything. How do I explain the COVID-19 management of Trump administration and Biden administration? I will say that I was not a Trump supporter, and you got to take it within that perspective. Trump realized, I think, that COVID was going to impact the country quite heavily, and United States presidents who are administering in a bad economy do not have very strong reelection possibilities. And so the easiest thing, I think it was to, I mean, in his administration, there was no vaccination. There was no solution other than closing businesses and staying home. And so the easiest thing for him to do was to say, there is no problem. Go back to work, make money, keep this economy going and everything like that. And it was probably his best effort at a message that would resonate and allow people to reelect him. It was a very close election, and he wasn't reelected. No matter what he says today, he wasn't reelected. But I think I mean, the vaccination did not become available until almost the time that he was out of office. And so it's a little unfair in that Biden administration probably got inherited an American public that was far more infected than it should have been because of the policies of the Trump administration. But he also had control of enough of the government that he could start to spend money very quickly and very hard. And he had a vaccination, he had multiple vaccinations ready to go. And so that by the time he got there, he could start inoculating people very quickly, and things could turn around for him very quickly, the vaccination being available. Once the vaccination was available and the scientists figured out that vaccinated people were relatively safe, then the economy could reopen and things could start to look better again. It's easy to blame too much on the Trump administration and the Trump administration policy. Oh, I'm sorry, am I done? I don't know whether I've taken up my whole hour or not. It's easy to blame too much on the Trump administration, but he did do a lot. He did make a lot of mistakes, in my mind. Are there any other questions?
Yes, it's a very wonderful topic for the lead of the hour. And you have mentioned the height of COVID-19, lockdown and shutdown, not only was only imposed in the United States, some of the states in the United States, for Europe and around the world. And how do you, also you have mentioned that how do you working for workers, not only in the United States, the support in the United States, you're working for, but also you're in India and also across the world. And so can you just very briefly just mention the how different types of initiatives that the United States, particularly the Biden administration, has taken for the development of the working poor in the recent times? Just a little bit, if you will give us some of the things.
The working poor is perhaps one of the biggest problems that has no clear solution right now. There are so many levels, so many different programs that it's difficult to say, you know, here's the agency of the working poor, they're going to be at fault or they're going to be responsible. And it's difficult to do that because we've got some federal policies, we've got some state policies, we've got some local policies. And one of the problems that we have within media, of course, is the idea of the information rich versus the information poor. If there's a program that would benefit me, I would have better access to that information, and I'm not working poor. And so I might take advantage of policies that the standard person who is truly defined as an Alice household may not even know about. And we've seen this over the years in American politics and in American media, that the people who are wealthier have better access to information and have better ability to capitalize on programs. And so too much of the money that is destined to help the people in poverty ends up in the hands of other people, simply because they know how to define themselves. And I wish I had a clear solution. We are doing things. There is policies that are placed to help child care centers. There is policies in place to try to deal with this foreclosure eviction problem. And there is a real effort to change the minimum wage in the United States. However, I note that here in this particular area, none of those policies, in my particular hometown, none of those policies are really being pushed very hard. So,
okay, because always the working people, the working poor has been suffering the most, always been in this lockdown or in this shutdown period, particularly in this pandemic period. The working people, not only there in the United States, here in also in India also, the working people have been suffering the most. Thank you so much, Prof. Steve Dix. If anybody want to ask Dr. Jena or Dr. Syama Prasad, Mr. and also anybody can ask the question. Otherwise, So join up the
No, no, Dr. Lima, please go for a vote of thanks. I thought.
Okay, okay. Thank you so much, and we are really grateful, Dr. Steve Big from the Southern Illinois University, Illinois, United States. Thank you for being with us. Thank you for giving your very valuable time with us on your busy schedule, and also accepted our invitation to share about 60 minutes, about 45 to 60 minutes with us. And really, you enlightened us about the COVID-19. The title is COVID-19 Lockdowns and Differential Effects from the Working Force in the United States. And thank you so much. And again, thank you very much. And also, I thank all the participants, those who have joined in the Zoom meeting, and the viewers in the Facebook, YouTube, and also in the Twitter. Thanks to I am the director of Sambalpur and the Vice Chancellor of the Central University of Koraput, Honorable Sandeep Prasad Nanda, and Charles Panigrahi, Saurabh Kumar Palika, and all the coordinators, Subham Das, Pawan Prasad Mahanti, Bhanshan Giri, Rudranayan Das, Chinmay Kumar Sahu, and all the students, researchers, teachers, professors, and academics. Also, thanks to Dr. Syama Prasad Mishra, Dr. Subhash Chandra Bari, and all the students and researchers. Thank you all. Have a good day. Thank you so much.
Thank you very much.